MSP's Impact Team formed in July 2020. Their goal is to save lives by getting drunk and drug drivers off the road.
The last state trooper that was killed in the line of duty was because of a drunk driver.
For Michigan State Police Sgt. Campbell, fighting drunk and impaired driving is a cause dear to his heart. He's leading the agency's first of its kind Impaired Driving Action Team, known as Impact.
One of my own troopers has been impacted directly from a drunk driver. While investigating an WEYI case, the trooper sustained injuries from that crash and was off the road for 3.5 months.
Servicing MSP's 3rd district that includes the entire thumb, the team looks for indicators of impaired driving like swerving and speeding, focusing on hotspots along the I-75 corridor, mainly in Genesee, Saginaw, and Bay counties. Trooper Corbin Holt is one of 4 people on the squad that will soon expand to 6 members.
What's kind of coming mainstream is drugged driving. With the legalization of marijuana, everybody thinks that you can smoke a bunch of weed and drive a vehicle, which is not acceptable at all.
From January to September of this year, MSP says the Impact Team made 220 operating while intoxicated arrests, 75 operating under the influence of drug arrest, and conducted 20 drug recognition expert evaluations. With every arrest, what are you hoping to accomplish?
When I arrest a drunk driver, I assume that I have saved someone's life. It could be the person that I've arrested, it could be the person that they passed by minutes before. It might be my partner's life.
With the holiday season around the corner, the Impact Team wants to remind people drinking and driving just isn't worth the risk.
It is a major problem that is overlooked. Statistically speaking, impaired driving is just as dangerous as dying by a gunshot wound.
The Impact Team says that Thanksgiving is one of the biggest holidays for impaired driving, and MSP will have increased patrols across the state.
Hospital visits have steadily increased within the last few weeks. According to the latest information from the state health department, McLaren Flint is at 96% of beds filled, and at Hurley Medical Center, they're at 100% capacity. Now, it's important to note that these are not just COVID-19 patients. They include all beds across the hospital system.
Our hospitals have reached out to us and told us that they are incredibly overwhelmed.
Current wait times in the emergency room could be hours long. Blaney says they are asking people to evaluate their symptoms, and if they do not need emergency room care, to seek other healthcare facilities.
We just want to make sure that, if you're somebody who's having chest pain, if you're somebody who's having trouble breathing, we want to make sure that that's who's going to the emergency department, not folks who could be using outpatient services.
Hurley Medical Center says all patients are triaged quickly in emergency. Then patients are seen based on the severity of their symptoms. That means some patients could be waiting a considerable time. The best advice is to see the medical professionals that best suit your needs and expectations, whether that is your primary care doctor, urgent care, virtual urgent care, or emergency. Putting thought into that choice can lead to better healthcare experience.
Dr. Bagdasarian, can you tell me why are we seeing such an increase of flu cases right now?
Well, I'll start out by saying that last year was an exceptionally strange flu season in that we didn't have a lot of flu. Last year was the anomaly. Because people were staying at home, they were masking, they were socially distant, we really didn't see the same type of seasonal flu uptick that we normally see. So this year, now that we have some pandemic fatigue setting in and people are no longer taking those precautions, we're starting to see a lot of flu circulating, and not just flu, but other viral respiratory illnesses like RSV.
Is this causing for some concern for health officials like yourself and also across the state?
It absolutely is. As you are probably following in the numbers, our COVID-19 metrics are looking very troubling right now. So we've had a slow rise in our COVID cases and in all of our COVID metrics since the early fall. And in the past week, we've seen a very concerning uptick in COVID. Now, couple that with what's happening in the hospital systems already. They're stretched with COVID. They're stretched with non-COVID care. And now we're entering into the holidays. We're entering into a time where we are expecting people to gather. There's a real opportunity for more transmission of these viral respiratory pathogens. And at the same time, we've already been seeing outbreaks of influenza. This is relatively early in the season to see influenza. And so it's a warning signal that things are not as they should be.
And you guys talked about earlier about that flu vaccine and how many Michiganders have gotten the vaccine. Why is there a push to get the flu vaccine, especially this year?
Well, every year we encourage people to get the flu vaccine because it's one way to protect yourself from influenza. But seeing these influenza outbreaks so early is troubling, and it really tells us that we could see a worse than usual influenza season. We could see a worse than usual viral respiratory season in general. And so we really encourage people to take every precaution they can to protect themselves from these types of pathogens this winter season, this holiday season. We'd like for people to be able to gather, but there are certain precautions that we just feel are necessary right now.
And the University of Michigan had more than 500 cases since October of the flu. Has there ever been something like this before? Have you seen something like this?
We've certainly seen bad influenza seasons. We've certainly had surges of influenza. We had a very difficult time with H1N1 about a decade ago. So we've certainly had bad flu seasons. But what we're dealing with now is different because we're dealing with influenza on top of COVID and a healthcare system that's already stretched really thin. So really, we need Michiganders to do whatever they can to keep themselves safe, to keep their communities safe, and really to take care of one another. I think this is the time, it's a holiday season, it's the time to really come together and do what we can to protect our communities.
And is the flu serious? Does it cause deaths? Have we seen any in the state of Michigan so far this year?
Influenza can be very serious. It's a range, it can cause a spectrum of illness. So some people have a relatively milder course, but of course there are some people who end up hospitalized in the ICU on ventilators, and of course it can cause death. So it's a range of illness. This is early in the flu season to really be looking at influenza hospitalization numbers. So we will be watching those closely. We generally see influenza surging in January and even February. So we'll be taking a look at those numbers as the season progresses, but it's concerning to have large outbreaks already.
Why do we have to get the flu vaccine every single year?
The thing with influenza is that it changes very rapidly. So as influenza circulates around the globe, there are different influenza strains that circulate. And so the way the influenza vaccine is formulated is we look at which strains are causing disease on the other side of the globe and which ones are likely to come our way. Sometimes there's very good prediction of which strains are coming our way, and sometimes there's not. But those trends change every year, those strains change every year. And so the only way to really keep up with influenza is to get that booster every year.
And we've seen super infections. I've talked to other doctors locally, and they've seen COVID flu, COVID pneumonia. Are you guys seeing that from a state's perspective?
It's a very real concern. So we know that any sort of illness, whether it's viral or bacterial, you can see two things coexist. You can see people with two viral infections, you can see people with two bacterial infections, and COVID is no different. So there's an absolute risk of seeing people with COVID as well as other viral respiratory illnesses. There's a very real risk of the same thing happening with influenza. We're keeping a very close eye on this. And as I mentioned, we really need to protect our healthcare systems right now.
And the state issued that mask advisory today. Will that hopefully cut down on flu cases?
I hope so, but the tools are now there. We have the tools, we have vaccines, we know which mitigation strategies work, and it's really up to our residents of this state to protect themselves and to protect each other. So I really urge everyone out there, if you haven't already had your COVID vaccine, now is the time to get vaccinated. If you're eligible for a booster, and that eligibility is actually expanding today, please get your COVID booster. Children ages 5 and up are now eligible for a COVID vaccine. So children are eligible to get vaccinated as well. Get your flu shot, and then please, Michiganders, mask up.
And we've seen an increase, like you talked about before, of hospitalization. Should you be going to the hospital with flu symptoms, or should you go to urgent care? Is there any advice on there?
If you are in a position where you are concerned about your health, if you're having difficulty breathing, if you really require emergency medical services, then of course you should go to the hospital. But for other routine complaints where you don't feel that it's an emergency, we do urge you to go to your primary care physician in order to save those life-saving hospital beds for those who truly need them.
Dr. Bagdasarian, is there anything else that you would like to add about this flu season that we're seeing right here in the state of Michigan?
We were worried about this happening last year. And last year, I think everyone did their part. People masked up, they avoided large crowded gatherings. And so we were able to avert this twindemic of circulating COVID-19 and influenza. This year, I know that people are tired. They're tired of the pandemic. They want things to go back to normal, but we're really in a crisis here in Michigan. We have some of the worst rates in the country, and I'm counting on Michiganders across the state to mask up, get their vaccines, and do their part.